Hi, I'm Dr. Eric Stowe from Snow Holistic Health, and today I want to talk to you about how chiropractic can help headaches. And so we're actually going to walk through a real demonstration of a chiropractic adjustment. So I'm going to come back here behind Mr. Phillip. Now there's several things you have to consider with headaches. There could be digestive issues, it could be hormone issues, but what we found is a lot of headaches are actually coming from a neuromuscular component. And so when a chiropractor assesses you, he's really wanting to see if you have proper alignment in your body. Your pelvis can actually be out of balance, and that causes an ascending pattern of torque through the spine and up to the shoulders and through the neck. And so the body will have to compensate for that imbalance. So that causes a lot of muscle tension in the rotator cuff, shoulders, and traps, and even the levator scap muscles, which will actually throw the tension into the neck. And so even with hormone-based headaches, food allergy-based headaches, we still find that there's still always a cervical component that needs to be cleared out. And so basically, one of the newer models for headaches is called the threshold model. So we're trying to find any stressors in the body that actually will build that tension up to the point of a headache. And so getting a chiropractic adjustment, making sure that you're getting all the soft tissue and the muscles assessed properly, and getting all that tension cleared out is also a part of our approach here at Snow Holistic Health. This is Mr. Phillip. He's our myofascial specialist, LMT, and he does all that work for us. And he did a video recently that covered that. But basically, what happens is through slips, falls, stresses, and traumas is the ligaments that hold the joints together, they actually weaken. And so when that joint ligament weakens, it allows for that joint to actually slip out of place. And the body doesn't like that. So the rule of the body is when the ligaments fail, the muscles will actually take over and they'll splint that joint just like you would splint a broken arm in a cast. What happens about 80 to 90% of the time is that joint gets splinted out of alignment. Now it memorizes that wrong position, and that's where the nerve irritation comes from and the muscle tension. So chiropractors are going to find where those joints are out of alignment, and we're going to use some motion, or what's called a manipulation, to actually put that joint back into play. So now we're just going to walk you through how we assess and actually perform a chiropractic adjustment for headaches. So Mr. Phillip, if you could lie down here on your stomach, face down for me. Okay, so we take a whole body approach. Of course, you can do just wonders by doing soft tissue work in the neck and shoulder area to reduce headaches. And then we definitely want to have proper alignment in the neck, especially the atlantal occipital joint, which is where your skull actually sits on top of your neck. And if that shifts out at all, it creates a lot of tension in these suboccipital muscles, which almost guarantees somebody headaches or more frequent headaches. But we want to start with the foundation of the body. The foundation of the body is actually the pelvis. So if the pelvis slips out, which is usually caused from some type of weakness or stress in the sacroiliac joints, it's going to cause your pelvis to twist, torque, and go uneven. And so your body's going to have to rebalance that. And so that throws a ascending stress or torque patterns up the spine, through the shoulders, and into the neck. And then we even get descending patterns through the hips, knees, and the ankles that we have to be considerate of. So one easy way to check is we'll actually just take a look here at your leg length. And Mr. Phillips is actually showing short on the right, and it's pretty significant. And so that makes me understand that his pelvis is out of alignment, and it's going to be a part of the issues with a headache pattern or some type of neck tension. And so this is a chiropractic table. We're going to lower the abdominal piece here, and then we're going to motion and check for any fixations that are being caused from that torque pattern. And all chiropractors are doing is we're finding where that joint is not moving, and we're helping it move again. And when you find that area, he's really fixated there to the shoulder blades all through the mid-thoracics. And when you get that joint to move, the chiropractic adjustment, that popping sound is actually cavitation of gases in the synovial fluid. And so that moved really good. We got good movement. I'm satisfied with the adjustment. So now we're going to adjust this pelvis. You get lie on your side facing me this way. So this is called side posture. This particular move here allows us to open up the lumbar facets in the pelvis so that we can fix any type of misalignments. Keep the spine nice and neutral. And put that motion back in there. Very good. Let's go the other way, Mr. Phillip. Now this is the side of the short leg, and so this ilium is actually going to be shifted out quite a bit. This definitely would be a possible part of a headache. Throwing that tension up and through the shoulder blades and shoulder girdle. All right, very good, very good. So on your back, face up for me. And so now we're just going to recheck everything and put some more extension. This is called the interior adjustment. Just basically creating a fulcrum with my hand and just making sure we got proper extension movement in the thoracic spine and upper lumbar. Moving really good. Alright, so now we're on to the cervicals. So this is really an area we're going to pay a lot of focus to, because that tension will come up through the neck and really cause some severe splitting of the occipital muscles and then the cervical paraspinal muscles. Now, cervical adjustment, a lot of people can be intimidated by the adjustment, but with the techniques that we use today in modern chiropractic, the movement of the neck is a really, really short amplitude, high velocity movement. So there's not any concerns about any type of stress that's uncomfortable to the patient. And just find that he does have some fixations there. So we're going to come in right at C2. It's just a real quick adjustment. And then he's actually fixated right at the atlas area there. Very good. Good adjustment there. All right, how was that, sir?
It was great.
All right, very good. So that is the chiropractic approach to headaches, looking at the neuromuscular skeletal components. Hey, if you have a headache, we want you to give our office a call because we know we can help you. Our phone number is 337-478-1313.